Money worries have a profound effect on health and well-being, both mental and physical. The constant worry of not having enough money to meet housing costs, pay bills or feed your family leads to stress, anxiety and feelings of hopelessness. Welfare advice and health partnerships are one way to address this. These partnerships integrate money and welfare advisors into GP practice teams so people's health and welfare needs are addressed together. When healthcare professionals identify money worries as an underlying cause of their patients' presenting problems, they can directly refer them to an advisor based on their practice. Advisors support people to increase their income, access social security entitlements, and resolve problems relating to debt and housing issues. Independent evaluations have shown that welfare advice and health partnerships allow GPs more time to focus on their patients' clinical needs and also reach people who don't normally engage with traditional advice services. But perhaps most importantly, they have a profound positive impact on the people who access them.
Money is a constant worry for me. As a single mum, I'm always having to juggle things. There's work, bills, rent, stuff for the kids, the list is endless. I never had enough at the end of the month. It was a constant struggle, really wearing. I was borrowing money just to get by, but that was only making things worse. It got to the point where I felt like I couldn't go on. I'd no energy, I couldn't face work, I couldn't sleep, felt low all the time, just constant worry.
I lost my job 18 months ago. I thought I was going to be all right and I'd get something else. I had bits and bobs here and there, but nothing regular. Money started getting a bit tight and I started borrowing just to get by. But when the work dried up, I started to get desperate. I was behind with the loans and payments on the mortgage. Things were bad. Thought I was going to lose my house.
I was in a really bad car accident about 5 years ago. I've been in a lot of pain as a result of my injuries. And I have depression because I can't do all the things I used to do. I struggle walking, so there's some days I often can't face leaving the house. So about 8 months ago, my benefits stopped as a result of an assessment with the DWP. I couldn't believe it. The money I relied on to live was gone. I was confused and angry and I just didn't know what to do. I mean, I was going to be left with no money, nothing to eat, to heat the house, nothing. My depression got worse. And I often thought, there's no point in going on.
I started drinking a lot and staying in all day. Avoided everything. I wanted to get back to work because I knew that would make things better, but I just wasn't in a place where I felt I could do it. I was lost. I knew I couldn't continue, so I booked an appointment to see the doctor. I had no one else to talk to. I was desperate. Well, the doctor was great. Said there's a lot of people in the same situation, and a good place to start would be to sort the money first. She said there was an advisor in the surgery that could help me with that kind of stuff. So she said, just go to the reception and make an appointment, it's easy. But I only booked the appointment because the GP referred me. It broke a lot of barriers.
I've always had a good relationship with my doctor, so I made an appointment to see if he could help with the way I was feeling. He was great, very understanding, and he asked about the problems I was having with my money. Then he suggested I speak with one of his colleagues at the surgery who helps people with money problems. The receptionist who made the appointment with the advisor also sent me a text message to remind me before it.
So I made an appointment to see my doctor because I thought she could supply me with a supporting letter or something. The doctor said she didn't know why my benefits had stopped, but it was happening to other people too. Luckily, Steve, an advisor who works at the GP surgery, he specialises in money worries and benefits. So she made sure I made an appointment with him. And a few days later I came back and I met with Steve and we went through all of the paperwork relating to my benefits. Because my medical records are quite long and I struggle to remember things, I allowed Steve to look at my medical records, and he said that would help to speed things up.
I was really glad to speak to a person about my problems rather than doing a random online search. I mean, there's just so much information out there, you just don't know what to trust. The advisor went through my money situation and was able to claim extra money to help with my childcare costs. That made a big difference. I hadn't realised I could do that.
So I met Jan about a week later back at the surgery. I was really paranoid about accessing the service and worried about giving my personal details. But, you know, I trusted the doctor, so I trusted Jan. Ends up, I wasn't claiming the benefits I should be claiming. That's the whole problem. I was brought up to feel that being on benefits is wrong. There's a stigma attached. But Jan wasn't judgmental, and she understood exactly what I needed. She asked if she could read what the doctor had written on my notes, because that would help with the benefit claims. She showed me what benefits I can claim for, helped me with applying, and even helped me sort out the debts and the situation with the housing. Her help was invaluable. Once my money problems were sorted, she put me in touch with a local group that helps people like me find jobs. It's been great. I feel like I'm getting my life back again, like I'm in control.
There were other things like help with the rent and council tax. I just assumed I wouldn't get because I was working. The advisor also got in touch with the loan companies I'd borrowed from and agreed repayments based on what I could afford. The service was absolutely brilliant and the advisor has been a godsend. I just wouldn't have been able to do all of that myself. I would have been lost. I wouldn't have known who to contact for the support I'm now getting, and it's really good having a local service.
So, within a few weeks of contacting Steve, things weren't as bad as they seemed. It was a very dramatic difference in such a short space of time. My benefits were back in payment and I'd got my life back. Steve was able to even access other benefits that I knew nothing about. I didn't even know I was entitled to them. You know, like a taxi card so that I could get out and about more. And that's made a massive difference to me. But it was more than that. It was more than the advice. It was a friendly face. Just the little things, like him writing things down for me because he knew how forgetful I was. I'm really grateful to him. And if this service wasn't available and easy to access, I'd have been totally lost.
This service is absolutely fantastic. If it wasn't for Jan, I would have lost my house and my health would definitely have deteriorated. I owe her a lot.